Osteoarthritis is the #1 cause of pain and disability in America. Last year, 750,000 people had hip and knee replacements. I'm Dr. Lou Pack, and what you're about to hear is revolutionary, because osteoarthritis is not due to age and weight as we are told. Sure, they're factors, but they're not the primary ones we're led to believe they are. Think about it. You know people that have had one knee or one hip replaced. Is their other knee or hip any younger? Is it carrying any less weight? Of course it's not. There has to be other factors, and there are. This is an 82-year-old woman who has had 2 knee replacements and a hip replacements, all I think totally avoidable. But osteoarthritis doesn't begin here at 82. Notice how she stands on one side with her right foot rolled in and her knee bent and turned inward. We could say that heart disease is due to old age because most older people have heart disease, but you know it really begins with children. Well, the very same thing is true of osteoarthritis. It too begins right here in childhood. Notice the very same pronated rolled-in foot that you just saw. At 8 years old, the pain in this child's knee is called growing pains, but once again it is due to the same rolled-in foot and turned-in knee. At 18 years old, the same foot type causes knee pain and is known as runner's knee, but it's all related and all due to abnormal alignment. Recent data from institutions like the Mayo Clinic now show that abnormal alignment causes our joints to wear out, just as driving your car in poor alignment causes your tires to wear out faster and unevenly. Now let's look at a remarkable case in point. Jean has been told that she has osteoarthritis and needs a total left hip replacement, and also has severe pain in her right knee. She stands much like all the pictures I have just shown you. But the real key is not how Jean stands and functions, but the difference when she is sitting compared to when she is standing. Notice that Jean looks totally normal, perfectly aligned, with no joint problems at all when she sits, as if her arthritis has totally disappeared. But this is very important because it shows that her problems are structural and functional and not due to a disease process. So the key is to find out what the underlying problems are that are making her stand abnormally and causing her pain, and then fix them so that when she stands, she is just as stable and aligned as when she is sitting. One very important yet often neglected problem is the difference in leg lengths. Although told that this was due to her arthritis, her leg length difference really caused her arthritis. Let's face it, even a Rolls-Royce doesn't ride well with different sized wheels and tires on each side. Tight calf muscles are another common underlying problem in osteoarthritis that is often missed. But by examining a patient carefully, the specific muscles that are tight and causing a patient to function abnormally can actually be determined. One of the most important causes of arthritis is pronation, or a flattening of the foot, as you have seen in previous pictures. Notice how unstable Jean is when she tries to do a simple squat, and the marked difference when standing on her special foot orthotics that I designed for her. Although her knees are not yet exactly equal, they will be as we work with her. But once again, notice how much more easily Jean squats, as well as her increased stability and balance. Because of this, she's had much less pain. Watching Jean walk in shoes that she has been wearing helps us analyze the effect of her poor foot position on all of her weight-bearing joints. And then, when wearing new shoes with the special orthotics I made for her, Jean's gait is much improved. The decrease in the amount that Jean's foot rolls in with each and every step she takes has a dramatic effect in decreasing the stress on her knees and hips. X-rays were taken of Jean standing as she normally does, and minutes later standing on her corrected foot orthotics. And to review, this is Jean standing before and after treatment. Notice the marked difference. Without any medication or surgery, there is a marked difference in the jammed, narrow joint space on the inside of her right knee before treatment compared to the well-aligned, completely open space taken just minutes later when standing on her new foot orthotics. Many people have foot inserts, but not any foot orthotic will do. They must be precise to optimally align the joints above the foot and eliminate symptoms. Jean has had a dramatic decrease in pain and has been able to resume normal daily activities. We use the very same principles to treat athletes and have helped 8 world record holders, many professional athletes, as well as Olympic gold medalists like Tim Mack, shown here. And age doesn't have to mean decreased performance. We've given many who thought they were well past their prime an edge they never had before. With our performance orthotics, Roel Bradstock, now 50, was the very first to qualify for the Olympic trials in the javelin. Not in the Masters, but in any age group, the oldest man in history to do so. Learn more about my work in the Arthritis Revolution, available on lulu.com and amazon.com. And if you'd like me to help you like I have Gene and the thousands of others that I have been privileged to treat over 40 years, please feel free to contact me. I wish you the best, and thank you for watching.